School districts around the country are welcoming students back to the classroom. Our next guest has important tips for how schools can stay open amid rising COVID concerns. Let's welcome Dr. Ezekiel Emanuel, Vice Provost of Global Initiatives at the University of Pennsylvania. He served as White House Health Policy Advisor in the Obama administration, was a member of the Biden transition team's COVID-19 advisory board. Zeke, in summary, vaccinate as many staff and students as possible, establish accessible testing. Everyone, even vaccinated people, need to wear high-quality masks indoors. Take any special get-togethers, pizza, things like that, move them outside, and improve ventilation of classrooms. Those are in a nutshell, those are the 5 things that you advocate for in the current environment we find ourselves.
Yes, and one of the things I should note is that 12 to 15-year-olds are eligible for the vaccine, and yet only nationwide 35% of them have been vaccinated. That's really way too low. We need to ramp that up to 95, 96%. Only students with good medical excuses because of they're immunocompromised or have other problems shouldn't be vaccinated. I mean, that's a number that we can really boost. Similarly, 16 to 17-year-olds are under 50%. We have to ramp that up as well.
If there's a vaccine mandate or close to it for a college, and these are young people to start with, so they're mostly vaccinated, then who are you protecting with the mask mandate indoors if everybody's? Are you protecting the students that aren't vaccinated that have decided not to? And we know that in the past there's been at least some conjecture that young people, since they seem to do better with COVID, that perhaps you don't need to be quite as stringent. This is a zero tolerance policy that you're advocating here.
Well, first of all, we are seeing a lot of spread among children. About 22% of new cases are now among kids. So we really do need to be much more vigilant, especially because many of them under 12 can't get vaccinated. Even among college students, I think that we know that the Delta virus spreads. We know that you can be asymptomatic, especially if you've had a vaccine, and still be infected with the Delta virus, and therefore you can unwittingly, not intentionally, spread it to others. The point of a mask is to protect you from other people, but also to protect other people from you. And I think in the United States, we also have to, one of the things I like to emphasize is move up on the quality of the mask, the wearing of the mask. We need N95 masks that are very, very well fitted. I'll say that's what I'm passing out to my students when I go back next week at Penn.
I'm just thinking about what the future looks like, and hopefully, I don't know what you think the maximum amount of vaccination percentage we can get in this country. But on colleges, I would think you're going to get pretty high. And if asymptomatic people are spreading it to asymptomatic people, it just seems at some point you don't need to be quite as stringent about it. What number would allow you, Zeke, in the future? Is it 90% of the country gets vaccinated? Could we take the masks off? Because even at 90, asymptomatic people that are double vaccinated can get it and spread it to asymptomatic people who are double vaccinated, who could then, I guess, run into someone somewhere at some point to get. So you see what I'm saying? We could essentially just be a mask. We could get permanent masks in your world.
No, we're not going to get to permanent masks.
All right, what do we need to get to in terms of percentage vaccinated? What do we need to get to?
In the current situation, a college and university like the University of Pennsylvania, we live in a larger community. A lot of our students live outside. They go in and out of a community, and those communities are much less than 90, 95% vaccinated the way the university will be.
So we're protecting the unvaccinated. We need to get, they need to get vaccinated, obviously. That's what needs to happen.